Hello everyone, I'm Gabriel C. Welcome in Studio 1. Today I'm going to share with you the process of making or writing a nursing care plan by student nurses. I will share to you vital information and tips on how to create a good nursing care plan. Step 3. Planning. The third step of writing a nursing care plan is the formulation of objectives of care, or also known as planning. After the diagnosis is planning stage. Here, you will prepare SMART goals based on evidence-based practice guidelines. You will consider the patient's overall condition, along with their diagnosis and other relevant information, as you set goals for them to achieve desired and realistic health outcomes for short and long term. Planning of care must be SMART. S for specific. Your goals for the patient must be well defined and unambiguous. M for measurable. You need to set certain metrics to measure the patient's progress toward these goals. A for achievable. Their goals should be possible to achieve. R for realistic. Goals must be within reach and relevant to the overall care plan. And T for time-bound. The patient's goals should have a clear starting time and end date, which can be flexible. Let us take a look at this example. At the end of 2 hours, the patient will achieve a good gas exchange as evidenced by 1. Oxygen saturation above 90%, 2. Absence of cyanosis, and 3. Normal ABG result. The goal of care must be specific to your client. It should be measurable and achievable, as you can see on a target oxygen saturation of above 90% and a normal arterial blood gas result. The plan of care must be realistic and time-bound, as stated at the end of 2 hours. Let us dissect our planning statement. The nurse must set criteria in goal formulation which will be used later on the evaluation phase. The above example as evidenced by 1. Oxygen saturation above 90%, 2. Absence of cyanosis, and 3. Normal ABG result will be the basis of your final evaluation, whether the goals are met, goals partially met, or goals unmet. I hope you learned something today on the third step of writing a nursing care plan, planning of care. The fourth step is implementation of interventions, which will be discussed in the next video. And that's the way it is. I'm Gabriel C. Thank you so much for watching. Until next time, stay safe everyone.